Welcome back. This is our consistent campaign to keep India clean and healthy. And this year, the big mantra as we fight the coronavirus is self-care and taking care of our own communities, our families. That is our Swasthya mantra. Do share your mantra for good health with us on ndtv.com/swasthindia. When it comes to any big change, changing oneself, changing one's behavior is extremely critical. Since the last 6 years, we have been trying to push for a behavioral change to ensure that right from childhood, we pick up the right hygiene habits, whether it's washing your hands, cutting your nails, the basic hygiene habits. To speak about what it takes to bring about that behavioral change, let's talk to Rajesh Chandy, the academic director, Wheeler Institute for Business and Development, and Ashwajit Singh, he's MD IPE Global. Ashwajit, let me come to you and ask you, we're always talking about behavior change. What is a behavior nudge and how can we really bring about that change, especially in communities?
Let me start by saying that a human being is not always rational for a self-interest. We end up doing a lot of things which are not aligned to our own welfare or well-being. So that's really what we are. And this whole thing about behavior change or nudge, as we call it, is really taking small steps, prodding gently and gradually to try and change the attitude, change the mindset, change the way we do our things through simple steps, through simple sort of prodding that we need to take. I'd really say that there are three aspects to what really needs to be done for getting around behavior change. First of all, that whatever we take up for doing towards changing behavior, that should be easy to understand. It should be easy to absorb. The changes that we are required to bring about should be easy for the person who's doing it to understand and be able to do it. Now, there's no point in going and asking for major changes without people having infrastructure or asking people to wash hands in a slum where there's no water. So you need to have changes which are possible. The second and perhaps the most important thing is it's all about communication at the end of the day to be able to bring forth this change. And now communication can be at a number of levels and a number of ways of doing communication. You can do communication at a one-to-one basis. That may work, may not work, because it's not easy to change the mindset of people. You will need to work very closely with community leaders, to try and explain why is it that they need to do that, how will they benefit by doing what they are asked to do, and if they don't do these things, what is the risk or the harm that's going to happen. Then, of course, communication through celebrities. I mean, Amitabh Bachchan ji is a great example of, in fact, all your Pulse Polio program, your TV programs, they're all about looking at behavior change and nudging people to change the ways that they're working or looking at. So getting celebrities to do that. Now, if you see a lot of celebrities wearing masks, celebrities talking about the pros and cons of hygiene, you will suddenly see that there is a shift in behavior change. And of course, in today's time and age, social media is a very effective way of doing communication change, as well as making films and clips. Again, it's very important that you need to localize and keep in mind the context that is really there. If you're making a film in a particular village or for a particular community, it should ideally be in maybe their folk language, or maybe get in some folk music along with that, or maybe get in some Bollywood music where they're able to connect with that. It's important to get in the opinion makers. The Prime Minister, for instance, his Janta curfew, his communication regularly with people, that's all towards instilling behavior change. Now, behavior change standalone has the risk of not becoming part of your system if it's not backed by sustainable practices. That is very important to make it sustainable. So you will need to eventually back some of these behavior, what is directed as behavior change, you will need to back that with some changes in legislation. For instance, now wearing masks has become mandatory. Gatherings of particular places are there. You will need to also look at getting it into the school curriculum, because at the end of the day, children are the best change agents. They are not only the ones who are going to be your future generation, but they're the ones who will go back to their home and come back and influence others around them. And then, of course, you will continuously need to look at training, look at how you're going to be making it embedded within the system. So I would say really that to get in behavior change, you need to look at what I would say a care framework, where C stands for calibrated change, a slow step-by-step change. It should be anchored and be practical, anchored in practicality. or is if we need to be reinforcing it and repeating what we really want them to do. And finally, it should be economical and something that we can easily do. So these are some of the steps that are required. It's not something that happens overnight. It's not something that one person can really do. All these things that I've mentioned, they need to converge finally, and all these have to be done simultaneously to be able to do that. There are so many good examples. I mean, when you speak about in the COVID situation, when you talk about people needing to wash their hands for 20 seconds.
Right.
In UK, they came up with a very small thing that sing happy birthday to you. That's a 20-second thing. So people there have actually started, children have actually started singing happy birthday to you, and that takes 20 seconds. And that's really made sure that they wash their hands for 20 seconds. So there are a number of such things. Or marking these zones for, when you talk about safe distancing, you go to the shops, you mark these zones. These are all small proddings that are done to make things happen. People used to be spitting on walls. Suddenly you find in a number of government offices and public places, you've actually got goddesses and gods there, their sketches or drawings there to stop.
Ashwajit ji, just like to ask you something. You know, what should governments do to nudge health and hygiene actions? And do you think you could tell us anything about any examples of nudges that you have worked in, you know, changing behaviors and norms? We heard a lot of what you had already spoken about, but from the side of the government, you know, is there anything that the government can do?
Yes, of course. I mean, to start with, the government needs to make this get this mainstream into the school curriculum, because we are clear. You said earlier in your program today as well that we know that the vaccine is not something around the corner. We also know that it's going to take years by the time it's going to be distributed widely, and then who knows, there's going to be a next pandemic coming in. So it's important for the government to inculcate and start this in the school curriculum. Important for the government to continue with its policies around masks and gatherings and social distancing. It's important for the government to continuously come out with research reports on the risks of what would happen if you don't do what you're doing right now, as well as positive news as well. It's important to get some positive news. It's good to see you, for instance, being here after having gone through this particular thing. It's also important for the government to recognize some of the best practices, come up with awards, recognitions, etc. And at the end of the day, it is extremely important for the government to also monitor what is happening. There's no point in making policies which are poorly implemented. It's more important to make, even if it's a mediocre policy well implemented, that's far better than making a great policy that's poorly implemented. There are a number of good examples of what governments have been doing around the world in various areas. Now, take the example of Spain, for instance. There they have a default option for organ donation. If you don't want to give your organ, you have to say, I don't want to give your organ. And as a result, Spain is today one of the leading countries as far as organ donation is really concerned. Similarly, in the UK, you've got an automatic pension plan. If you do not say, I don't want to get into a pension plan, people get into a pension plan. Or for that matter, in shops or in malls, if you start putting sanitizers and hygiene and masks at the cash counter, replace that with chocolates and candy bars and things, that itself will automatically do that. And above all, of course, the government would also need to continuously provide facilities, because there's no point going and telling villagers to wash their hands if there's no water. There's no point to tell them to sanitize if that's not available. So I think government has a huge role to play in this entire thing to make it sustainable and long lasting.